Everyone, myself Dr. Tapush Kumar Pal and welcome to our channel Physiomax organization. Under the part of Physioversity, we are continuing our medical educational series, and under this part we have already read about this ulnar bone as a part 1 series where we gone through about the surface anatomy, about the site determination, about the border and the surface, and about the bony landmarks. And the next part of the part 2 we'll be seeing about the muscle attachment of this ulnar bone, and also we'll be seeing the applied anatomy of this ulnar bone, by which we'll end up with the anatomy of this ulna. So today we'll start with the first point about the muscle attachment of this ulna. As you have seen in this ulnar bone, and this is for the olecranon process, the first muscle what we'll be seeing, that is the insertion, and this is the region where the triceps muscle is to triceps brachii. This is the muscle which is to get insert in this region. On the posterior aspect of this olecranon process is the insertion of the triceps brachii muscle. If I see over here, that's the medial area, and here you can see the first muscle is the flexor, is the origin of the flexor carpi ulnaris, and this is the highest origin of the flexor digitorum profundus. So this is the two region. One is the flexor carpi ulnaris, and this is the flexor digitorum profundus. So now if I go this side, so here you are having from the above downward, medial margin gives origin to the flexor digitorum superficialis, and flexor digitorum superficialis, pronator teres, and flexor pollicis longus. Flexor digitorum superficialis, pronator teres, and the flexor digitorum flexor pollicis longus. In the posterior border, of this ulna, we are having the origin of the flexor digitorum profundus. We are having the flexor carpi ulnaris and the extensor carpi ulnaris. So these are the three muscles which are present on this posterior aspect of the ulna. Now if I see the lateral part gives origin, so this is the shaft and this is the lateral part, gives origin to the abductor pollicis longus. This region, there is a origin of the abductor pollicis longus, and below of that we are having the extensor pollicis longus and extensor indicis. So these are the three muscles which are getting originated from the lower shaft of the ulna. Coming to the lower end, a groove between the styloid process and the posterior surface of the ulna. So here, so in this region, the tendon of the extensor carpi ulnaris which are attached over here. Tendon of the extensor carpi ulnaris muscle which are getting attachment of the here. So these are the muscles which are attached in this ulnar bone. So now in another part we'll read about the clinical anatomy or the applied anatomy of this ulnar bone. So the clinical anatomy, the applied anatomy of this ulnar bone, the most common is pulled elbow. Pulled elbow is a condition which is also named as a nursemaid elbow. It happens amongst the small children whose this ulnar olecranon process which is not yet ossifies and not get mature to make a hook which is attached to the olecranon groove of the humerus, and that resultant whenever people used to hold the hand of a small child and is to rotate, there is a sudden chance of dislocation of the olecranon process from the olecranon groove. So that makes what it's called as a pulled elbow or the nursemaid elbow. As by the name you can understand, it happens due to a sudden pull, and which makes the ulnar bone to come out from the groove. That's why it is called as a pulled elbow. Nursemaids who used to take care of the small childs, they used to more prone to make the child rotate using this hand, and that makes the hand to go for a dislocation, and that's what is the most important applied anatomy of the ulnar bone, is the pulled elbow or nursemaid elbow. So by this we will end up with this video, and today we have learned about the muscle attachment of the ulna, and we have also learned about the applied anatomy of the ulna. I hope you are getting benefited from this type of anatomical educational series. So those who are new for this channel, don't forget to subscribe the channel, and those who are watching our videos, don't forget to like this video, and thanks once again.